Welcome to the CMSC's virtual poster tour. This poster is titled A New Look at the Symbol Digit Modalities Test, SDMT, in Multiple Sclerosis and Disabilities. I'd like to introduce the presenter, Elan Liu. She is a second-year medical student at the University of Alabama at Birmingham School of Medicine. Welcome, Elan.
Thank you so much for having me.
Your research talks about the information processing speed component of the SDMT. Can you tell us a little bit more about that component and how it is evaluated?
Yes. So information processing speed is like how quickly a patient can solve a particular problem or puzzle under a controlled setting. And so going into more details on SDMT, it became a preferred examination for information processing speed because it can be very sensitive to general cognitive decline, and it's very simple and brief. It's only 90 seconds per test, so you can solve it really quickly, and it's very inexpensive, and it allows you to measure general disabilities in MS and not just focus on something like walking and motor functions.
Now, your research records eye movements during the test. What can eye movement tell us about a person and how they are processing information?
So we are using eye movement as a way to tap into the subconscious of patients in some ways and track their attention and how much they're focusing during the SDMT. And it allows us to have a visual data of when the participant is looking up, looking back at the key, or when they're getting lost. But this allows us to look into that as well and figure that out and maybe apply working memory with it in the future to really reflect that the eye movement is actually tapping into their subconscious.
Do you use a software program to analyze the patterns of the eye movements?
So right now we are just using simply Excel and PowerPoint. In PowerPoint, there is actually an animation feature, and through what we're doing with the tracker, our results suggest that there's a positive correlation of the number of upstrokes, or what we call as looking up, and the SDMT score. So we're saying that in persons with MS, the more that they looked up, their SDMT score actually improved. So the participants who are particularly slow on the SDMT wouldn't be looking upward as often as patients who were faster on the SDMT, who looked up more. But there's like a point when participants are particularly fast on the test, and they have so well memorized the answer key that they just don't have to repeatedly look upward while they plow through the test.
I'm going to ask you about the colored graphs that you provided on the PDDS results. Can you show me what it is we're looking at here?
Yeah, sure. So this is Excel generated representation of the eye tracking. The first one you're looking at is the result of someone who had the worst SDMT score. And this person's score was a 12 items correct out of 15 total items answered.
Mm-hmm.
And their PDDS score was a 4. But you can kind of see just visually it's very disorganized and they don't make it far. But if you see the graph that's next to it in comparison, this person had the best SDMT score with 60 items correct out of 61 total. You can see how very organized it is. Like you can see all of them, they go in a pattern sort of. They kind of look up, and look up, and then they go back and forth, back and forth.
Yes, that is interesting. And finally, what are the implications of this research and what studies would you expect to do in the future?
So we are adding more control participants currently to assess differences between control and MS. Kind of even looking back at the graph that I provided, there was one representation of the control which is a lot more organized. So we want to show something that's kind of similar and put it into more data form, if that's accurately represented or not. And also, we would like to analyze the data further to somehow pinpoint a pattern in cognitive slowing that we see in multiple sclerosis, which could be used to develop rehabilitation techniques.
I really appreciate your taking the time today, and thank you so much for participating.
Okay, thank you so much for having me.